I'm Dr. Joanne Bird.
And I'm Dr. Chuck Bird, and welcome to another episode of Intimate Chats with the Lovebirds.
Yes, and in today's episode, we're going to be talking to you about erectile dysfunction, or ED, formerly called male impotence. And we think this is a very important topic to talk about because ED affects anywhere between 15 million and 30 million men in the United States.
That's a lot of men out there.
Exactly. And so you got to find out what the cause is so you can find out the best solution. And erectile dysfunction really means that the man is having difficulty either maintaining an erection or even getting an erection.
Sure.
And so the first thing that we want to talk about are the possible physical causes of ED because that's the majority of the cases.
Right. And those physical causes can be due to surgery,
Right.
like if you have prostate surgery, because it can affect those nerves and blood vessels down there,
Right.
or even medications, the side effects to them, the antidepressants, antihistamines even,
Right.
Or a medical condition in general, like diabetes or cardiovascular disease.
Exactly. And in 2010, there is a study that talked about
Right. ED is actually a predictor of heart attack, death by cardiovascular disease, or even stroke.
Exactly. So you've got to talk to your doctor to make sure there's not a medical cause to this ED or that there's not some serious medical condition there. And so you've got to do that. And then after you've talked to your doctor, the next thing you've got to take a look at is the lifestyle risk, really, the choices that you're making in lifestyle. So it could be excessive drinking, drug use, smoking will cause erectile dysfunction, and also being overweight.
Right, and ironically, avid bicycle riding, you would think they're healthy, they're riding their bike, but because of the seats putting pressure on the perineum area, it definitely affects the nerves and the blood vessels down there. And they're actually making seats now that are actually look like a V, so that pressure is relieved. There's no pressure on that area down
Exactly. So if you're an avid cyclist, you need to look into those seats. And then what you need to look at are the possible psychological factors that could be causing ED, and they can be things like depression, stress, anxiety, low self-esteem, and even performance anxiety. And so we always suggest that you talk to a board-certified clinical sexologist or certified sex therapist to help you address those factors causing it.
So these are just some of the causes of erectile dysfunction. And we hope you tune in next episode because we're going to be talking about how to treat erectile dysfunction.
Exactly. Hope this helps. As always, wishing you more connection and passion in your relationship. Bye-bye.